My name is Husain Abbas. I'm a general and bariatric surgeon with an interest in complex gastrointestinal diseases at Memorial Advanced Surgery. So I've always been interested in surgical sciences and kind of the art and science of surgery. And really my journey starts a couple decades ago where I went to medical school in Dublin, Ireland. I went to the Royal College of Surgeons in Ireland, and then I worked and taught in surgery in Ireland. And then after that I decided to pursue my career, so I moved to the United States where I did a residency in Connecticut and then did a fellowship at University of Florida in Gainesville. So my practice here is quite wide and has a variety of diseases that I deal with. About 30 to 40% of my practice incorporates bariatric surgery or metabolic surgery, and that includes both first-time surgeries or redo surgeries, what we call salvage of failed surgeries. The other about 60%, I do a wide variety of general surgery, and that includes dealing with gastrointestinal diseases, so I do gallbladder surgery, hernia surgery. I also do some surgical oncology, which is cancers of the colon, of the stomach, of the pancreas, but also diseases of the breast, which is probably about 20% of my practice. And this could be either a benign disease, so for example, a lump that was felt and we removed and there's nothing more that needs to be done, or a lump that was more sinister and we perhaps need to treat it further. The practice of surgery is very challenging, but it's also very, very gratifying. I enjoy actually taking my patients and trying to reassure them that we are here for them. They are the star here. It's very important to keep the lines of communications open. I am very accessible and very easily reached. I can be reached on my cell phone, by email, if somebody wants to send me a picture of some wound or something to show me, and my office is almost 24 hours open, accepting phone calls or queries from my patients, and I try to get back to them as soon as possible. The reassuring patient is the most important part of my job. Even though this is probably a cliche, I do truly treat everybody as family because it really makes my decision-making very simple then. What if this was my sister, my mother, my brother? Then the decision-making becomes very simple. And I would like them to know that they will receive the best care available in the United States here locally at Memorial.